So our study at the University of Manchester looks at BMI trajectories over time and the associations of developing an obesity-related cancer. So this work is novel because we look at BMI over time rather than just assessing somebody's BMI at a single time point. And we know that the development of many cancers is over years, maybe decades. So it's really important to try and quantify BMI exposure over time. A BMI trajectory is a set of measures of BMI over time, so it just allows us to quantify somebody's weight over time. Well, what we're trying to do with this study is we're trying to quantify their exposure to obesity in the past. So rather than just taking somebody's BMI at an exact time point, we want to know how they arrived at that BMI. So for example, if somebody has a BMI of 30 kilograms per metre squared, then typically in a study that value would be accounted for, but it wouldn't tell you how they arrived at the value of 30. So some people could have a BMI of 30 from age 18 to 65, so their weight hasn't varied at all, whereas other people may have had a BMI of 20, increased to 22 to 25, and then finally reached a BMI of 30. So we're trying to differentiate between the difference between the two people in the study, rather than just assuming that they have the same BMI, so they have the same obesity-related cancer risk. For this study, we used a very new novel method that is picking up traction in the literature. We use latent class linear mixed models. So this method allows us to identify subpopulations within the big population. So it's really good for heterogeneous populations. And the method itself discovers the BMI trajectories and the paths of BMI based on the data. So we deemed the model with 5 latent classes as the best model for the study. So some of these BMI classes were relatively lean and slowly put on weight, whereas some of the other BMI trajectories had rapid weight increase and then tailed off, or some had rapid weight increase and just continued. So we then associated each of these BMI trajectory classes to obesity-related cancer risk. And we identified, compared with the lean, healthy, normal population with the largest proportion in, all the other BMI trajectory classes had an increased risk of developing an obesity-related cancer. So the implications of this research could be that we could identify individuals on a bad trajectory at an earlier point, so then we have a chance to intervene and to bring these back to a normal BMI trajectory path to ultimately reduce the number of avoidable cancers. I'm based at the Health eResearch Centre in Manchester, and we're trying to use health informatics to improve healthcare services for individual patients and for the community. So at the moment the study that we looked at is an observational cohort study, but we are hoping that for the methods, if we can include BMI measures and we can identify people on a harmful trajectory at an earlier stage, then hopefully the GP and the healthcare services can help us to help the individual take responsibility of their BMI.